Miguel Gomez, director of AIDS.gov, is at CROI 2015, where he spoke with leading HIV researchers about the latest news from the conference.
Hello, this is Miguel Gomez with AIDS.gov at CROI, talking with Ambassador Birx. Ma'am, you presented today to a full house, and I would like to ask you to share some of the highlights from that presentation today.
Well, the biggest highlight was people that came and listened. This is the largest gathering of scientists from around the globe that are focused uniquely on HIV/AIDS, and both clinical scientists, basic researchers, bench scientists, and I think what's been spectacular over the last decade is watching that translation of bench science through clinical research and into the field with such rapidness. And we're running as fast as we can to implement their new findings, and I just wanted them to hear how we're translating their work into the field, and importantly, how we are committed to using data to understand how to make our program more impactful.
It was wonderful. You brought us up to date where we are in the epidemic globally. You then opened yourself up to get feedback from the crowd from here at CROI. And what you also did is you grounded where PEPFAR is going and some of the issues you're facing through examples. Could you share what you talked about when you talked about Kenya?
Two things that we noted, and I personally noted in going through the data, that a lot of our success of new infections in a series of countries has really been driven by our unprecedented success in driving down maternal-to-child transmission. And so whereas that has declined by over 300,000 in sub-Saharan Africa just in the last decade, we haven't made as big an impact on heterosexual transmission. I think people would have interpreted based on the overall decline in new infections. And indeed, if you look at Kenya specifically, although they have driven down new infections, almost all of that has come from their incredible prevention of mother-to-child transmission program. So what we are trying to do is then utilize the depth of data that we have and make the data that's granular down to the site level available to everyone so that they can really understand in country, they can understand, Tanzania can understand how Kenya's focusing, and around the globe they can look at our data and understand what we're trying to do. And I think at our fundamental, most critical element is to analyze how a site is performing for results, but also look at the quality of those results and the cost of producing those results, and also to ensure that those are geographically aligned where the epidemic is. So we've gone down to the county level in Kenya. The Kenyans led this effort. They have this Prevention Revolution roadmap that's really extraordinary, where they've analyzed the entire country down to the county level and really shown where there is HIV and where there isn't HIV. And we're taking that the next step down to the site level and saying, what can we learn about transmission patterns from our program data? What can we learn about how we need to geographically focus to have a bigger impact? And how can we translate the U.S. taxpayer dollars into the most effective program that we can, of course in partnership with the country. But because each of those dots and each of these pieces and each of these analyses represent either someone accessing prevention services or not, representing them accessing treatment services or not. And we want to make sure that the prevention services, the orphans and vulnerable children services, the treatment services are all aligned where the epidemic is.
You also you started your presentation with a very powerful statement about the importance of addressing stigma. Could you share that with our viewers?
Well, we talked about where we were 20 years ago in the epidemic, and we talked about where we were before Global Fund and PEPFAR, where in sub-Saharan Africa there was only 50,000 people on treatment, where the life expectancy had dropped by 20 years, and that stigma and discrimination raged on the continent. And I think what's telling to me when you look at each of those bullets, we've made tremendous progress. We've reversed life expectancy, we've increased the productivity, there's economic growth on the continent. Probably in sub-Saharan Africa alone, 8 million people or more on treatment. And then stigma and discrimination. So if anything, it's more visible, it's more evident with these legal frameworks both in Uganda and Nigeria. It's deeply concerning. But it's not just Nigeria and Uganda. It's country after country who believe that stigma and discrimination has a place in public health responses, and it doesn't. It doesn't have a place in communities or in the public health response, and we're just trying to make sure that everyone knows that the United States government and certainly President Obama and Secretary Kerry are not supportive of stigma and discrimination in any country, and LGBT rights are important around the globe.
Thank you. Well, thank you. And just one last question. As our viewers will watch this, what would you say, as you're looking towards the future of PEPFAR, what would you like to share with them?
That it's possible to control the epidemic, but not possible unless each one of us do the part of focusing our resources in a way that we can have the most dramatic impact. Once we get control of the epidemic and you decrease the number of new infections through really comprehensive and integrated prevention, like we launched with the DREAM initiative focused on young women, when you turn off the tap and decrease the number of new infections, then you can do a lot more in a horizontal way. And we're committed to the horizontal work we've done, but we're also committed to creating an AIDS-free generation.
Well, thank you for your commitment and that of your team. This is Miguel Gomez, very grateful for our time together from CROI 2015. Thank you.
For more information about the conference, visit www.croi2015.org. And for more information on federal HIV programs, visit AIDS.gov.